So you're treating people with sleep apnea. People, I guess, have a CPAP, they can't wear it, and now they have another option. So tell me about that.
Well, you've got a couple different options. So we get referrals all the time from our physician friends.
Like medical doctors will refer you people for sleep apnea?
Medical doctors will refer us.
Okay.
Because the patient's been on a CPAP and it just has not worked out. And there's a percentage of people to where just a CPAP is just not going to work. Either it doesn't help the symptoms or the patient just can't simply tolerate the CPAP machine.
Okay.
So they want help, they need help, but the CPAP is just not the answer for them.
Okay.
So a traditional approach would be for some type of mouth appliance to be done. And that what that does is it helps the jaw move forward, helps the tongue come out of the throat to help that person breathe better, okay? So during the day, most of these people don't have any problem breathing. They feel fine. But when they go to sleep, they lay on their back or even their side.
So what, the jaw's dropping back?
The jaw
the tongue
drops back, the tongue drops back into the throat, and then they can't breathe at night. They wake up in the morning, they don't feel refreshed, they don't feel ready to go, they got to get their cup or their jug of coffee.
So they think they're sleeping, but they're not?
They think that they're sleeping just because that's their normal.
But you say they're waking up like 10 times in an hour?
Or more, 50, 60, 70 times an hour in some people.
Okay.
It's amazing. And so these people are really just being caffeinated pretty much all day to try to stay awake. And it's surprising that
we all know what it feels like to not sleep.
Absolutely.
You feel lousy.
Right. And research shows that if you do have sleep apnea and it goes untreated, you're 2 to 3 times more likely to suffer a heart attack or stroke. So there's significant health consequences to not sleeping.
So you make a custom-made appliance, opens up their airway, and then they sleep.
They're able to sleep, yes, and then so we test that before and we test that after, so we can make sure that the improvement that we've gotten is where we need it to be.
Now you say some people with sleep apnea that their partner, their spouse, sleeps in another room.
Yes, that happens all the time.
They're so noisy.
They're so noisy that you're not only affecting your sleep. If you're the one that has the sleep apnea, you're deteriorating the sleep of your loved one, your spouse or your significant other, and they can't sleep either. So both people are pretty much running on empty at all times because nobody's sleeping. And so somebody ends up moving to another bedroom. That obviously has significant risks involved in just your marital outcome or your relationship.
Have you had stories where they're back in the same room?
Absolutely, yeah. And so it's nice that you almost feel like you're contributing to a good marriage or a good outcome in those relationships because they can be together and they can sleep together, and they're both much healthier for it.
So you've had people that tried the CPAP, but they just didn't like it, and now they do this and this works.
Absolutely, yes.
So you've gotten people off CPAP.
Yes, we have. For the people that can't tolerate it or the people that it just doesn't work for, we have been able to help them.
Now, what if they're not quite diagnosed as sleep apnea, but they're loud snorers? Does this work for that too?
Absolutely. It helps with snoring. And so there's 2 conditions there. There's typical sleep apnea, and then there's what's called upper airway resistance syndrome. It's almost like sleep apnea, just a lesser form of it. And so most of the time, the people that are snoring loud, even if they don't have sleep apnea, have the other condition, and a mouth appliance works really well for them.
Do you ever have, because I guess more men than women get sleep apnea or snore, do you ever have women that drag their husbands in to get this done?
Absolutely, yes, because they just can't take it anymore. The husbands seem to, humans are really great at adapting, and so people just adapt to their condition.
Because you don't even know you're doing it.
You don't even know you're doing it. You don't even know what it feels like to sleep well. If somebody was to ask you, well, how well do you sleep? Most people are going to say, I sleep just fine. But that's really not the case. So the spouse ends up being the one to motivate the husband oftentimes to come in and get treated so she can sleep well.
So how do you prove, you have like statistical data? A sleep study or anything is done?
Yes, the first step is oftentimes we have to do a sleep study to see where they're starting.
Home? Do you have at home?
We have at-home sleep tests, or if they've already seen a physician, the physician's already done a sleep test in a lab.
Okay.
And then after the appliance or the procedure's done, then we'll take a new study, a new sleep test, oftentimes at home, or they can go to a sleep lab. And so we can see what the end results are to see how much improvement that we've gotten.
Have you had people that, like you said, they're up like 40 times an hour, 30 times an hour, and now it's down to maybe only 2-3 times an hour?
Absolutely. The range is if you can get somebody under 5, that would be considered within the realm of normal.
And then they wake up.
They feel like
an
entirely new person. It's amazing.